Morning, ladies and gentlemen of the media. I will be giving you some updates from our last two cabinet meetings, since we were not able to have a press briefing last week. The first decision that I'd like to report on from this new government and the cabinet was that the cabinet was asked to consider a request to relocate the Ministry of Justice from 2 Oxford Road, Kingston 5, to the Commerce Gate Office Complex situated at 61 Constant Spring Road, Kingston 10. The reasons for the relocation request were due in part to various issues related to poor air quality of the Oxford Road building since March 12, 2014, the negative impact of the health of the staff of the ministry and the operations of the ministry and its departments. And finally, the order by the Kingston and St. Andrew Public Health Department for the closure of the offices. After consideration and its urgency, Cabinet approved the relocation and approved the release of a sum of up to $100 million to fund the related expenses. Cabinet also approved Supreme Ventures Limited as the preferred bidder for the privatization of the Caymanas Track Limited, CTL. The final sales terms, however, are to come back to Cabinet for final approval. Of note, a decision had to be made on what is called the vote on account, which is the carry-on budget. As you're aware, we had a change of government. And this was approved as per projected estimates of $83,839.8 million, and the tabling of the resolution and a related ministry paper in the House of Representatives will follow. Cabinet also approved the disposal of 75% ordinary shares of Separate Limited, held by Coconut Industry Board, and the proceeds of this sale is to be paid to the Accountant General as a special distribution in keeping with the financial distribution policy for public bodies. Cabinet also approved the increase in payment to government pensioners, ranging from $1,100 per month for those persons receiving pensions of $60,000 per month and up. And at the higher end, in terms of increase, we saw $2,000 per month for those receiving pensions of under $30,000 per month. Cabinet also approved the change of name from the Bureau of Women's Affairs to now become the Bureau of Gender Affairs. Cabinet also approved the award of contract for the placement of insurance coverage for the Port Authority of Jamaica, PAJ, for the period April 1, 2016 to March 31, 2019. An approval also given for the renewal of the contracts, insurance contracts for the NHT to cover similar period 2016 to 2017. And of note, Cabinet approved the proposal to contract a 15 million gallon water treatment plant at Content Recobre in St. Catherine. And this is of significance because this contemplation represents one of the first initiatives under the new government's 10-point plan initiative, which is geared towards facilitating growth and development. And we expect within 18 months, once this project has started, then we should see a significant improvement to the ongoing problems for the greater Kingston metropolitan area during times of drought. I'd like also to announce that the Caribbean Sugar Company, as you might have heard in the media, is under severe pressure in terms of its own profitability. And Cabinet has been seized of the situation because the company has signaled their intention to cease operations, and the government is moving swiftly to intervene, not to take over the operation, but to seek to get other private sector interests to work together to make sure that this project and the production of cane takes place. And more so, we'd like to see that the matter of the cane industry is revitalized. I know there has been much talk about the proposed toll rates, and as we speak, I expect that this evening or tomorrow there will be some announcement in regards to this matter. Cabinet has been receiving reports from the Honourable Minister of Transport on the matter. We have heard the cries of the people of Jamaica in regards to asking for us to negotiate a better deal, and we are working very assiduously behind the scenes to see how we can address these concerns. I am not going to be able to give you any more detail, but the government is seized of the concerns, and we are going to be working very, very hard to see how we can negotiate, if possible, a better arrangement. Before I invite Minister Tufton to give an update on the matter of the Zika and H1N1, I'd like to take this opportunity to indeed join with all Jamaica, or condemnation and indeed sympathy to the people of Belgium and Brussels in particular, as we have heard about the incidents of terror in that part of the world. And also, I want to note that there has been concern about CXC and the e-marking and the extra paper matter. But we have been in touch with CXC, and we want to assure the public that CXC will be working to ensure that extra paper will be provided just in case that students require the extra paper. So is Minister Tufton has stepped out? All right, when he comes back, he will give us an update. But I will take some questions, 15 minutes by virtue. Okay, Marlon, Robert, rather. It's 83 billion, what is it? 83, well, I mean, it's just a clarification. I had mentioned, which sometimes I guess is how government data is written, but the figure I gave you for the carrying budget would have to be interpreted as $83 billion. You got that? Let me give you the actual figure. I had said 83,839.8 million. So it has the same meaning as saying 83,839.8 million. So I'm just saying, just in case somebody misunderstood the figures I was giving. So perhaps you're better understanding in billions. Oh, I want to also speak to another matter of concern. I've heard reports of it. Officially, the government has not signed off on any boards. So while I can concede that there have been discussions in terms of possible selections of board, I'm not aware that Cabinet has officially signed off on boards for any public bodies based on the change of government.
Morning again everyone. We're going to have Dr. Christopher Tufton making a presentation now, looking specifically at H1N1 and the Zika efforts at the Ministry of Health. So Dr. Tufton. And after Dr. Tufton, the Minister of Information will take the podium again, and we'll have 15 minutes of questions.
Thank you very much. Good morning. I'm going to read from a prepared statement. The Ministry of Health continues to ensure that the public is kept updated on all Zika and H1N1 related issues. We have relied on our stakeholders, private partners, as well as the media, and want to thank you, the media, to continue our public awareness on prevention methods, and we certainly thank you all for the support. The Ministry will continue to strengthen our partnership to ensure that our messages to empower Jamaicans to secure their health is received island-wide. On Friday, and I'm speaking now about Zika in particular, on Friday we had a press conference where I indicated that we had an additional 3 cases of Zika, making the number at that time up to 4. Since then, we have received confirmation over the last 24 hours of a 5th case, 1 additional case. We have sent more than 300 samples for testing and are still awaiting results for 145 while we continue surveillance activities. This means that we expect, I think, reasonably so, that we expect additional positive results based on what we have seen so far, based on the samples that we have tested. In terms of those that have been tested positive, the breakdown in terms of the geographic location, 4 cases in Portmore, St. Catherine, and 1 case in License, St. Thomas. 3 of the new cases were confirmed by tests carried out at the University of the West Indies Virology Lab, which now has increased capacity to test for Zika based on the 10 million equipment that was secured by the Chase, with support from the Chase Fund. In other words, we are now in a position to do our own testing. Before that, we had to send the samples to the Caribbean Public Health Agency in Trinidad. And in fact, most of the samples that are still outstanding are those that were sent to Trinidad. We, however, did keep a part of those samples here, and I've asked the technocrats to proceed to do our own testing of those samples that are in Trinidad, as well as the new samples that come in. A coordinated approach continues in our attempt to minimize the impact of the virus with our vector control activities, surveillance, and public awareness strategies. Our National Emergency Operations Center will continue to coordinate the response. The island-wide enhanced surveillance system is in place to monitor all cases of fever and rashes, neurological syndromes and congenital malformations, and any other presentations consistent with Zika. In this instance, or in this case, ladies and gentlemen, the physicians, whether in the private or the public sector, are absolutely fundamental to this process. What we encourage Jamaicans to do is, if you have a symptom, then you visit your physician, whether you're a private physician or at the hospital or clinics, because it is based on their recommendation that the process is moved further towards testing and treatment. The ministry also continues to actively investigate to detect any other cases that might be present in the areas of the country. We're engaging or have engaged in a fogging blitz, which has started in the affected communities. This means that fogging will take place in communities for 3 consecutive nights per week for 3 weeks to eradicate adult Aedes aegypti mosquitoes which spread the Zika, dengue, and chikungunya viruses. Our vector control activities, especially in communities with high levels of mosquito breeding, have been ramped up. The ministry, through its Operation Mosquito Search and Destroy National Cleanup Initiative, continues to motivate and mobilize everyone to search for and destroy mosquito breeding sites around their homes. The first leg of the initiative was done in February in St. Catherine. We officially launched in St. Anne. We're going to Manchester this weekend. But the launch is just a formality because the work is taking place across the country with particular emphasis on the areas that we have assessed and considered to be major breeding ground for this type of mosquito. Our public education campaign encompasses television. You may have seen some of those, radio and print. Public education material have been distributed to several schools, workplaces, and all regional health authorities. All Zika-related information is also placed on the Ministry of Health's website, as well as our social media platforms. We continue to receive support, which we are happy for, from the Pan American Health Organization, part of the World Health Organization. We recently hosted a mission with experts from the World Health Organization from Geneva, Switzerland, and a professor of neurology from Chile who assessed our surveillance mechanism and have expressed a commitment to continue to give us support in this area. This is the trajectory of the Ministry of Health's mandate: to keep the country informed and continue to encourage everyone to play their part in fighting the spread of Zika. And I pause here to say that the truth is we're all at risk, but critical to managing this risk is how we treat with our environment, our immediate surroundings in and around the home, because these breeding sites are in fact clearly identifiable, and if we take the time to examine, to search, to get rid of them, what we're actually doing is reducing significantly the risk to ourselves and our families, and indeed to the community and by extension the country. I'll quickly give you an update now on H1N1. The Ministry of Health's key message in mitigating the spread of the flu virus is one of prevention. We are reminding our citizens that the flu virus is not spread by the Aedes aegypti mosquito, but by poor hygiene practices. So let's not mix up the two, it's very important. The ministry is therefore imploring everyone to follow proper hygiene practices to minimize the spread of the flu virus. The National Influenza Center has reported 71 confirmed cases of influenza so far for 2016, 66 of which were influenza A, which is commonly known as H1N1. And the remaining 5 cases were different strains of the virus. As of March 20th, 2016, there were 6 deaths in person who have been confirmed to have influenza H1N1. The persons who died and had risk factors for other severe diseases. I'll just comment briefly on that, not to be insensitive to those who have passed, but the fact is that there are groups that are more vulnerable than others. If your immune system is compromised, the very young, the very old, persons with chronic illnesses, lifestyle diseases, hypertension, diabetes, etc., then contracting H1N1 places you at particular risk. Pregnant women, we have spoken about that very importantly because of the potential risks that are involved, both with Zika but also with H1N1. The ministry's National Emergency Operations Center will continue to coordinate the response. Our public education campaign has been ramped up in the form of television, radio, and print messages. Public education material have been distributed to several schools, workplaces, and all regional health authorities. Regular press releases are also sent out to the media, and we thank you for helping us, as is the case here. All H1N1 related information is also placed on the Ministry of Health website, as well as on our social media platform. As it relates to the vaccine, Tamiflu, we recently received some 5,000 additional doses of flu vaccines, in addition to the 3,000 adult and 400 pediatric doses we had previously distributed to the regional health authorities. All registered physicians, and this is a recent policy position taken by the ministry, all registered physicians are now able to prescribe Tamiflu, the antiviral medication used for treating influenza, and all pharmacies will be able to stock the drug as of March 16th. Also, instructions for preparations to begin for the next flu season has already commenced, because again, one of the approaches of the government is to not to be reactive to these incidences, which are relatively predictable. We have a flu season each year, but have become more challenging because of the different strain of the virus that is spreading. The virus mutates, and it has become more difficult to manage. What the data suggests is that we are not necessarily having more cases of persons contracting the flu virus, but those who have gotten it in an advanced stage, up to H1N1, have gotten it in a very severe way, more severe than normal, and indeed to the point of it being life-threatening. And so it's a consequence of the environment around us, it's a consequence of how we interact with the environment, but it's also a consequence of these viruses adjusting and mutating and changing over time. So we want to be able to be more prepared, not just for this season, but in the seasons in the future, the next season. It is critical that the message of personal responsibility be a focal point in the nation's fight against Zika and H1N1. Each Jamaican can make a difference by preventing mosquito breeding and controlling the spread of germs. I am confident, the government is confident, that we are attempting to take all necessary precaution, starting with ensuring that the country has information, because it is with information that I think we can take action. So we're very transparent about it, but ultimately, I believe the fight has to be taken on first and foremost at the level of persons within their homes, in their immediate space. It's about personal responsibility. The government can provide you with the information. The government can ensure that our physicians and other critical health workers are updated, are protected, and if you are unfortunate enough to contract, then there are the hospital services to deal with it. But ideally, prevention is the best cure. And we cannot emphasize that enough. As Jamaicans, we are all in this fight, and our actions will, to a large extent, influence the risks that we confront, that we face. I'm available for questions after. Thank you.
Thank you very much, Dr. Tufton. And as I indicated earlier, we have 15 minutes for questions, so I'm now ready to take any question that you may have. Yes, Ms. Janelle.
Janella Precious, TVJ News. This is actually for Dr. Tufton, but since you're on Since you're at the podium, I'll just start with you. 1,000 sugar workers have lost their jobs since August last year. I hear you saying that the government is now moving to intervene in the situation with the Caribbean Sugar Company because they are saying now that they're going to cease operations in Jamaica. How serious is the situation, one, and intervention, how?
The situation is very serious. The information I have that the accumulated loss is now about $60 million US, and that has arisen largely because of, the world price of sugar has fallen by about 40%. And so what we are seeking to do is see if we can get other private players, particularly to get involved in the sugarcane cultivation part of it and proceed with the diversification of the sugar industry, so just not relying on bulk sugar alone. And there are a lot of acres of sugar we're talking about, up to about 38,000. So we think that there are opportunities for collaboration with other players so that the business can remain viable. So you're not limited only just to bulk sugar production, but all the other aspects of the cane industry, ethanol and energy generation, etc.
Have you identified any of these investors, or are you still looking?
As reported, there of course I can't name, but there are good prospects.
And Caribbean Sugar Company, they want to cease operations effective when, sir?
It's a very urgent matter, and we need to find a way forward by June.
Oh, so they plan to cease operations by June?
Yes, so it's an urgent matter.
Okay, thank you so much. For Dr. Tufton, sir, how much money has been spent so far on vector control activities? How much money has been spent so far on vector control activities? I've also...
I'm told over 200 million so far.
Vector control activities, they've been ramped up in Portmore, but we see a concentration of Portmore with the Zika cases. What is not, I don't know, is the message not being adhered to? I can't explain.
No.
And also in St. Catherine in general, we also have an increase in dengue cases.
Right. Okay,
St. Catherine's just seem to be
I
an
don't understand
issue,
sign
sir.
language, but I'll
No,
try
no,
to
sir,
interpret what
no,
you're
but
saying.
my issue is that the vector control activities, it has been ramped up in that particular parish,
let me
yet
just-
we're still seeing increase in dengue cases.
understand.
And we're still seeing Zika.
Well, let me just say, and Dr. Delahaye, who is the CMO in the ministry, is here, so he can assist me with some of the technical details. I'm, of course, new, and I'm still briefing myself. But as I understand it, the country is zoned as it relates to the mosquitoes now, Zika, chikungunya, in a way that identifies more vulnerable areas. Because as you know, depending on where the breeding ground is, are located, some natural, others man-made, those areas are seen as more vulnerable. So Portmore, unfortunately, is one such vulnerable area. In addition to that, once a case is discovered, then that area automatically is placed in the vulnerable group, and it triggers a particular response. This is part of the emergency response. So in the case of Portmore, the first case was discovered there, and we have, the health authorities that is, with the help of volunteers, we have visited some 4,000 homes after that incident, informing the public, the citizens, helping them to identify breeding sites, eliminating those sites. But it was clear that once you had one infected person, the chances of having others are greatly enhanced, because no one knows whether or not this mosquito, which has a 3-week lifespan, would have moved from one place to the next, or another mosquito would have bitten that person and move on to someone else. It's almost logical that it happens. So it's not that we did not anticipate that it could occur again because it has occurred at least once. And so what we did was to move in. And so that justifies your question. That's why we have had stepped up activity in those areas. As it turns out, we have discovered one case in St. Thomas, and the same would apply to St. Thomas. Now, one could argue that the fact that we have found a few other cases is a reason to suggest that it's not working. Otherwise, one could argue that if we didn't intervene, you would have found a lot more cases. I would prefer to agree with the latter, because I must say that the efforts on the ground to inform the public has seen or shown or demonstrated persons getting more engaged, more informed, and also taking action in and around their immediate surroundings.
Dr. Tufton, just to follow up on general as well, the point you just highlighted, are you of the
Ron Powell, RJR. Are you of the view that it would be instructive to alert members of the public to the specific area that the case is from, and this possibly, I'm not sure, I'm no expert, that it would spur persons to be more aware and probably start doing the precautionary measures that they should take?
Well, we have done just that. We have identified Portmore and the specific areas. Which are the specific areas? Greater Portmore, and the last one was in Gregory Park somewhere, right? Yes. So the news release has actually identified a specific area, and in the case of St. Thomas, it's licensed in St. Thomas. And for that very reason, to communicate with persons living in and around that area, that they are perhaps more vulnerable, and they should take the necessary precaution.
Sir, over 200 million spent, how much more are you going to need?
Well, it's a function of literally tracking what is happening, monitoring the environment, the situation on a week-by-week basis. You know, the rainy season is about to commence in due course. That adds some additional risks, and we have to monitor that very carefully. It's difficult to quantify a figure. If having spent that, we still feel that the environment and people are at risk, then we're going to have to make provisions to spend more. The ultimate objective is the protection of the public and to keep them informed and to work with them. But I cannot stress the importance of personal responsibility. I mean, we can hire 1,000 persons to go in a community and find all the milk tin and the old tires and empty water and to, you know. But the truth is, the day after we leave there in the rainfall and somebody throw another old tire out there, you create another breeding ground. And, you know, it's quite instructive. It may sound theoretical, but we have to have a mindset or a cultural change in the way we treat with our environment, because it has a direct bearing on us as individuals. And we're going to have to make that a central part of the message that we're trying to get forward. We have to take responsibility, while as government we help you in that fight by providing the necessary facilities to support you. I should mention, I don't know if it was mentioned earlier, that on the fight against Zika and even H1N1, there is going to be a meeting. The Prime Minister has summoned a meeting with a number of ministries so we can move for a coordinated approach. The Ministry of Local Government, which, as you know, has the responsibility for cleanup. The Ministry of Tourism. Tourism is very important, and so we have to control these types of outbreaks because it may affect our tourism numbers. The Ministry of Works and Ministry of Education. So we hopefully will have a meeting soon among ourselves to try to see to what extent we can have a coordinated approach towards public education, but also towards the cleanup campaign.
Good morning. Morning, gentlemen. Edwin Campbell, Gleaner Company. First of all, Dr. Tufton, what percentage of your frontline health staff has been vaccinated to date? And my second question will go to Mr. Royal Reed. Should I ask it or wait until you answer? Oh, go ahead.
Yeah, okay. As I understand it, approximately 90% or so of the frontline health staff have actually taken up the opportunity to get vaccinated. It's a voluntary process. In the past, I am told that up to between 25 and 30% would opt not to be vaccinated. I don't know if you understand the technicalities of it, but simply put, a vaccination really represents you're being injected with a small dosage of the virus, and then you develop your own systems to fight it. And some people have a difficulty with that. So in the past, we have had a take-up of a certain percentage, but since the outbreak and indeed the tragic loss of a few of our health practitioners, we have seen a much greater take-up, which we think is a good idea. And I think we're about 90%. There is a need, based on our assessment, to import some additional doses of vaccine. And I think there's another 1,000 from Trinidad, which will get in the island soon, to allow for all who are so concerned to actually take up that offer. So I think we have done what we need to do. Of course, the vaccine is available in the private sector for others who may choose to exercise that right.
Mr. Reid, you spoke about the $83 billion carry-on budget.
Yes, sir.
That will be tabled when Parliament sits
Next week, Tuesday.
Tuesday.
Yes.
Can you just give us an update on plans to table the estimates of expenditure and the ceremonial opening of Parliament?
Okay. Just briefly, the plan is to have the ceremonial opening of Parliament on April 14th. And preceding that, we are slated to have Cabinet retreat starting next week. That's March 30th to April 1. Plan also to have preliminary Cabinet consideration of the budget on April 4th and final consideration on April 11th. And so that would allow Standing Finance to look at it May 3 to 5, and the budget debate would be between May 9th to 19th. And hopefully we get that to the Senate for its deliberation on May the 27th. So this is the proposal, and there may be some tweaking here or there, but that's pretty much what is before us.
Morning, Althea Saunders from the Jamaica Observer. Minister Tufton, can you speak a little bit about what is being done to ramp up resources within the health facilities themselves? I know you've spoken about vector control and so on, but what's happening with the staff and other implements for proper patient care?
That would take an entire day. You asked me a more generalized question.
Specific to the viruses that we have.
Oh, specific, all right.
Yes.
Well, as I said, we have spent a couple $100 million so far, and we will assess the challenge weekly, and if we need to go back for additional resources, we're going to have to find it from whatever source to ramp up that program. We're assessing the outreach program as we speak. We're going to be out in the streets more frequently, myself included, in order to heighten the awareness. Because as I said before, the awareness is, to my mind, the most fundamental, most critical. Resources could be financial, but it could also be human. And I think if we are able to communicate effectively with persons, they in turn will communicate to those that they are in charge of or they come in immediate contact with. We have had some volunteers, and we're encouraging that also. So the short answer is, if we need additional resources beyond what we're doing now, based on our assessment of the risk, we will find those resources. And finally, of course, we are trying to protect the frontline healthcare workers within the system. The persons the lab which does testing, I visited last week, and because we now have that piece of equipment to confirm within a few days whether or not someone is infected, that has given us significant capacity to respond once we discover infection. Early detection is very important to treatment. We have taken some decisions as it relates to personnel in order to deal with the possibility of any backlog. We had someone there at the ministry, from the ministry working, and we have decided to extend that person in order to be able to provide for the testing. We worked with PAHO to allow for validation of the tests through the Centers for Disease Control in Puerto Rico. So where we have a positive test, the sample is sent to Puerto Rico for validation, and that's more for planning purposes than anything else for the future, because we think it's important. Beyond that, the numbers that have been tested positive, I think we do have the capacity as of now to deal with those. You know, if it's severe case, for example, of H1N1, then, you know, the issue of, what do you call the emergency ward that they're placed on? Isolation, right? Intensive care. Maybe the doctor can help me here with some of the technical terms, but we have been talking to the institutions to ensure that they have the isolation area, because an infected person, you really want to keep them out of contact with others for fear of transmitting from one to the next. So far, I think we are doing okay because of the numbers of the cases. If it gets worse, clearly we may have to reevaluate. So it's something we have to consider on a periodic basis.
Minister, I hear that there has been some resistance on the part of some individuals. They don't want to stay in the isolation areas.
Are you experiencing that?
Hearing that for the first time, but I mean, a patient doesn't have a choice. Depending on the illness you have, we have to direct you to where you need to be. If it's orthopedic, it's an orthopedic ward. If it's an infectious disease, you must be in an isolation area. So I don't know that it's a choice for patients.
You can always find people who are persons who, you know, don't want to comply with the rules, but we have to do what we have to do to protect the greater good.
Morning, Abka Fitzhenley, Nationwide News. Question to the Information Minister. Morning to you, sir.
Good morning, sir.
The appointment of boards, board
Yes.
chairman,
Yes.
by when do you estimate that will be known?
What I would want to work with, as I announced, in regards to the cabinet retreat, because I think where we are now, and there are a number of boards to consider, I'm not expecting we'll be in a position to really make any announcement until post-cabinet retreat. But as I indicated, I concede, as ministers, there are ongoing consultation, and we have to be looking for persons to fill those positions. But I don't expect us to be in a position to make any formal announcements about boards. And of course, as soon as each board is named at the appropriate press briefing, I will make the official announcement.
Tell me, Bruce Golding, sir, is he being considered for an appointment to any board?
I'm not aware of that. I've heard about that, but I'm unaware of that, and that has not been brought to my attention.
Has any representative of the Homeless Administration entered into discussion with Mr. Golding concerning the NHT, sir?
I'm unaware.
Thank you.
Mr. Reid, just want to
Yes.
clarify the issue about the board. We spoke to the Transport Minister last night, and he confirmed that Gregor Mayer is a new chairman of the JUTC. So I was just kind of confused as it relates. So it is that some of the boards have been named, but you may not.
Well, I'm talking about the official submission to cabinet. I have no such information because that has not been brought to my attention. And I'm saying the official position is that the government has not named any boards at the moment. That's the official position. Thank you very much, ladies and gentlemen.
Thank you very much, ladies and gentlemen. Really happy for a successful post-cabinet press briefing. Would like to thank the Minister of Information, the Minister of Health, and the acting Chief Medical Officer in the Ministry of Health.